And joining me now is family medicine physician Dr. Marie Ramas. She's joining us from New Hampshire. Thanks so much for making this house call with us, doctor. This new variant, Omicron, is it more powerful than regular old COVID? I don't even know what to call the original COVID.
I know. I feel like we're learning the Greek alphabet here, honestly. But, so every change and every variant of the COVID virus has different nuances to it. And so we're watching science in motion right now, and we'll need to see if it actually is more powerful, more potent, more contagious than what we've experienced here with Delta. That is still to be continued. But what we do know is that we need to continue to use the mitigating factors that we know work, which is washing hands, wearing masks, and making sure that we're protecting ourselves and our patients around us.
How would you even know, though, if you have COVID? How would the average person even know if you have the regular one, like I said, the Delta, whatever, Lambda, all the different ones, and now this Omicron? Would you have different symptoms? Would they be able to tell at the doctor's office? I mean, if I went to you and I had COVID, would you know which one I had?
You're right. And so a lot of the symptoms that we have with COVID are similar to the common cold or even the flu. And so I strongly encourage folks that if they're having any hint of symptoms that they need to make sure that it is first not COVID. What we're seeing is that because we're having more lax behavior in some of our states and in some of our regions in the United States, that we're seeing spikes in COVID infection for this reason. I often get my patients saying, "Hey, doc, it was just the sniffles," and then a week later, I came down with a fever, and now, of course, they came back positive. Now, one of the interesting things, and that's still yet to be determined, is whether the current tests that we have available to detect COVID, whether those tests would be able to be used as well to detect our new variants. Hopefully, fingers crossed, that will still be the case.
Yeah, absolutely. So, with the vaccines, though, I think people are nervous. There's some people who still haven't gotten any shots. There's people who've had one shot. Now, some people have had the booster shots. I mean, the list goes on and on and on. People are nervous about this, taking all these vaccines. Will it even help now that we have this new strain?
Right. And right now, the tests and the studies are showing that the vaccine is going to be effective. Luckily, our contact from South Africa, who did talk about the COVID-19 variant Omicron, actually made note that if our public health opportunities were as robust as they needed to be with vaccination, then perhaps the Omicron variant would not be as much of a threat right now. And so, what we can do, and what the CDC actually recommended just not too long ago, was that those who are 18 and older do get a booster shot. And if they aren't vaccinated fully, this is a prime opportunity to get vaccinated because in the United States we still don't have the Omicron variant as prevalent. And so, this is the time that we need to take to make sure we take the precautions to protect ourselves.
Yeah, we don't know where that thing, who has it, and where it's going. So, thank you so much for that advice, doctor. We appreciate having you join us this afternoon. Take care.